So patient educators at Revision are very important for our patients and for their experience and for the explaining process and walking them through what they're about to have with either LASIK or cataract surgery or corneal transplants. It's a really vital role. The patient educators truly are an extension of the physicians, of the surgeons.
What it's like to be an educator here at Revision, it's wonderful. We get to learn so many new things. We get to be in so many different scenarios and meet so many new people. We get to be a part of people getting better vision every single day and seeing their reaction and walking them through that process.
So we actually encourage the patient educators to come into the room while we're doing our exams with the patient so that they hear that exchange between the surgeon, the surgical recommendation, and the patient's kind of interest level, concerns, and hurdles. And so the patient educator becomes the point person for that patient through their surgical journey.
And we also rehearse together, how to speak to patients about different procedures, how to set expectations, how to describe the surgery, what it's going to be like before, during, and after. And so you're really doing physician-like counseling for patients. I tell patients, as I'm wrapping up, do you have any questions? And if not, and if you think of some as you leave the room, like a lot of times happens, they kind of relax and questions pop up. I say, this person is an expert in all of the options that I just talked to you. If you think of any questions, they'll be able to answer it. If you stump them, I'm here to help as well.
It's crucial that we are in the room with the doctor as they're speaking to each patient. Every patient's visual outcome is unique. Every patient's eyes are unique. And we are aware that patients are receiving a lot of information, and we want to make sure that they're understanding all their options, their vision outcome, and all their expectations.
The patient goes from the surgeon, the doctor's recommendation, and then goes to the patient educator for all the other details. What the patient's going to experience before, during, and after surgery. What their insurance is going to cover, what their insurance may not cover. Those details need to be explained to the patient. So it's really a vital role, and it's a challenging role, but it's incredibly rewarding.
There are certain personality traits or skill sets that are going to be a good match for a potential patient educator. Enjoying education and teaching is a definite bonus and is pretty vital when it comes to educating patients. You have to be knowledgeable on these procedures, which we will help you with. We'll help you fully understand them, but then be able to communicate them so anybody would understand it. They've never heard this terminology before, and they've never thought about eye surgery before, so you really have to not overcomplicate it, which makes your job easier. You can speak in plain language and help walk these patients through it.
That patient in front of you, you have to have the innate ability of wanting to help them. Understanding that, anybody who's faced with the prospects of having eye surgery is a scary proposition.
We want to be there for each and every one of our patients from start to finish. And we understand that this is a difficult decision to make, and it's a decision for the rest of your life. This is vision for the rest of your life, which is super important to each and every individual. Surgery education is a great fit for me. It's an amazing opportunity to learn new things that I've never learned about. I'm able to be flexible with my schedule. I'm able to meet new people and develop new fundamentals and grow as a person.
So educators, super important, and we can never have enough quality educators here at Revision. Love working with them, and they're vital to pulling off what we do on a day-to-day basis.